Today, our talk is about joint preservation, specifically hip and knee joint preservation. I am Dr. Kenneth Doolittle, and I've been here in Mount Vernon since about 1990. I'm a board-certified orthopedic surgeon, and we do largely adult reconstructive work here, both surgical and non-surgical. And today's talk about joint preservation, it means different things to different people. Joint preservation to some people means totally non-surgical. To me as an orthopedic surgeon, the point of joint preservation is to keep people going, to keep you doing the things you enjoy doing, whatever that may be. Typically, low impact activities are going to be better than high impact activities like running, jumping, twisting, turning. But low impact activities like walking, cycling, treadmill, hiking, low impact sports too, like golf and so forth. These are the goals that most people are going to have. From a joint preservation standpoint, for me, what it means is keeping people active. It doesn't necessarily mean non-surgical treatment. There's a variety of non-surgical treatments, and certainly surgery is more of a last resort than a first option. But sometimes it does mean surgery, and there are certain surgeries that we do to try to first preserve the joint. Unfortunately, there's no magic pill that makes cartilage regrow. There's no magic pill or potion that makes cartilage regrow. And obviously, people have been selling snake oil for a long time, since the 1700s. But from my standpoint, what I try to present is objective medical data, things that have been proven to work. And so there are things that you can do to try to restore cartilage surfaces. There are autologous, which means moving cartilage from one spot in the joint to another spot in the joint. There's allograft cartilage, which means taking cartilage from someone else and putting it in the joint. There's also a procedure called Carticel, which is taking cartilage cells from an immature person and putting them into a spot, into a bed that you've prepared to try to get new cartilage to grow. But out of all of those things, probably the least invasive thing is to do the allograft cartilage, where you do it's sort of a dowel graft thing about the size of my index finger with a cartilage cap and bone graft underneath, and you basically make a spot in the bone in the joint to fill with that spot. And we've used that in different places: the knee, the hip, the shoulder, the elbow. So that's one way to preserve a joint. What I'm going to talk about today, just from a general standpoint, the point of today's talk is patient education, to try to get information into the community as to what we might do. And one of the keys, of course, we use the word prehabilitation, which means rehabilitation means after surgery or after something's been done. Prehabilitation means before. And so preparing a joint for what you're going to do is an important part of having a good outcome. They say the prepared mind favors a good outcome. So that's part of what we're talking about there. And it's a team approach to care. I mentioned some of the biological healing techniques already, nutritional support, and prehabilitation techniques. Sometimes we have you go to physical therapy to sort of get things ready to be able to tolerate the procedures that we're going to do, or the ideas that we're going to have. But basically what we're going to talk about is sort of an overview of hip and knee preservation. We'll go over what the normal knee and hip anatomy is, and then a review of what is arthritis, because that's really what we're talking about, is wear and tear or osteoarthritis. And we've talked about some of the treatment options already, and a review of the recovery, and then we'll give you time for questions as well. Patient education involves physical conditioning, nutritional support, minimally invasive techniques that we mentioned, things that can be done through the arthroscope or injection. And then we have a comprehensive care program for follow-up. In other words, we follow along to make sure that things are going the way that we think that they should. So first, just to kind of review, the hip joint, basically that's a ball and socket joint, where the femur bone is the ball and the pelvis has the socket. The knee joint, there's three bones. There's the femur, the tibia, and the patella, or the kneecap. From a arthritis standpoint, what is arthritis? That's an inflammation. Itis means inflammation, and arthro is joint. So inflammation of the joints and loss of the cartilage. And what is cartilage? If you break open a chicken bone, you see that shiny surface on the end of the bone. Well, we have that on the end of our bones as well. That's what cartilage is. When that starts to deteriorate, that's arthritis. There's two main types. There's inflammatory arthritis, and then there's wear and tear arthritis. Inflammatory arthritis would be like rheumatoid arthritis or lupus or psoriasis. There's different forms of inflammatory arthritis. It's not quite as common as osteoarthritis, but the inflammation leads to osteoarthritis. From a joint preservation standpoint, with rheumatoid arthritis, it's important to have the proper treatment, and that's where a rheumatologist might be involved. We mentioned the team aspect of joint care. A rheumatologist is a person who specializes in non-surgical treatment of arthritis, and they have medications that you can take, and some of them you see on TV like Humira and some of the ones that they advertise. There's other ones too. Typically you can start off with methotrexate or gold therapy. Sometimes we do cortisone injections to control the inflammation because it's the inflammation that's the problem. When the joint swells, that starts to stretch out the ligaments, then the joint becomes unstable, and then that's what leads to the deterioration of the joint. So that's sort of the rheumatoid arthritis part of it. Osteoarthritis is wear and tear arthritis, is more common. According to the CDC, it's probably higher than that now. That's a 2020 number. Probably 40 million Americans have some form of osteoarthritis. And what is it? It's a degenerative condition affecting the joints. And what are the symptoms you're aware of? Obviously pain. That's the main reason people come to see the doctor, because something hurts. Other things that you'll find are going to be joint swelling, stiffness. You start to lose the movement in the joint, which then causes you to limp. And over time, if the arthritis goes on far enough, I should say, you'll end up with deformities, and you'll start to see like the knee will go, we say knock-kneed or bow-legged in the knee. You start to lose movement, and that's when it's getting to the point where joint preservation, when you start to see a deformity of the joint, that's where you sort of shift from non-surgical treatment of the joint to surgical treatment of the joint, because to preserve joint function, you've got to restore limb alignment and you got to restore joint alignment so that the joint moves and works properly. Why do you go to the doctor? You go to the doctor for pain. You want to arrive at a proper diagnosis. So you might see x-rays. There's other lab tests sometimes that we do to measure inflammation. And we examine the joint and get x-rays, as I said. From a general standpoint, there's other things to consider as well, and that goes with seeing your primary care doctor. There's other conditions that affect how a joint feels. There's things like diabetes and gout and other things that can affect, and those have to be managed and treated properly as well so that you can maintain joint preservation. So those are part of what you consider when you develop a treatment plan for the joint. We just talked about what some of the physical examination findings are: decreased range of motion, pain with movement. We say the Rice Krispies knee, snap, crackle, pop as you move it. And so then we look at x-rays, and there's a couple of things to see on this x-ray. The one on the right-hand side, that's a normal x-ray of the knee, and you can see just from a general standpoint, the joint surfaces are nice and smooth. There's space between the bones. There's not any chips of bone or calcifications in there. If that sort of knee is giving a person problems, that's where you really can do non-surgical treatment options. And that's where we can do things like, if there's a spot, we'll get a test like an MRI to further evaluate. You know, if there's torn cartilage, that can be trimmed and removed. If there's a spot that's wearing down, a small spot that's wearing down to bone, that's where we can do those bone cartilage transplant procedures that I mentioned at the beginning. The knee on the left-hand side here is more, you're getting down to the point where it's bone on bone. Like I said, there's no magic pill or potion that makes cartilage regrow, and that's where you're starting to look at something else is going to have to be done to preserve that joint. And that's where you end up having to do things like total knee replacements or partial knee replacements to maintain function on the joint. So we just talked about what the findings are that with the abnormal knee. When you start to get down to bone on bone like that, that's where you're not going to be able to do non-surgical joint preservation techniques. So what are the goals of treatment? Obviously, number one, control symptoms, including pain, swelling, dysfunction. So you want to optimize function. And how do we do that? Well, first, there's an educational part. That's what this is, part of an educational process of going over what are the options for treatment. And we talked about some of them. And I'll see if the next slide has, that has some of the things that you can do. First of all, become proactive. Lifestyle changes, certain medications, injection. Sometimes, as I said, we end up with joint replacement to restore mobility. When it comes to lifestyle changes, that means things like diet, activity, and that's where physical therapy can come into a beneficial treatment, because you can work on range of motion and strengthening, physical conditioning, physical reconditioning, gait and balance training to prevent falls. That's a big part of it. Injury can definitely affect a joint. If you have a fracture that goes into a joint, that's a problem. That can lead to what we call post-traumatic arthritis. So gait and balance training, physical therapy for restorative is an important part of the process of lifestyle changes. Medications can be of benefit. There are medications that can help. Tylenol arthritis is an extended release form of Tylenol. Some of this depends on your medical conditions as well, and you can take anti-inflammatory medicines and arthritis pills, and there's different ones. There's about 50 different ones out there. The ones that are available over the counter are going to be ibuprofen or naproxen, which the trade names are Advil or Aleve. But your stomach has to tolerate them. We say you should take them with food so that it doesn't irritate your stomach, and it also has an impact if your kidney function isn't good. You have to be careful about taking anti-inflammatory medications. So there's risks and benefits with any of the treatments that we're talking about. One of the next things that people always ask about are injection therapies. And there are different things that are out there. And there are some that have been in the press, they've been amplified, but they haven't really been shown to be beneficial from a treatment standpoint. And one of them is when they did a big thing on the stem cells. And some of my patients had stem cell, I don't do those, but some of my patients had stem cell injections. They were very expensive, and there was no proven benefit. In fact, the Food and Drug Administration went after the people that were doing them and who were producing the so-called stem cells, because the preparations that they were providing, they couldn't even prove that they were really stem cells. So that was kind of a problem. So the FDA kind of went after them, and that's, if you've noticed, that's kind of gone by the wayside a little bit. Another one is the hyaluronic acid preparations. That's like Synvisc or Hyalgun. And there's different preparations with that. That particular injection therapy has been around since the early 1990s. They were really introduced in about 1992. So they've been around for a long time. And they do help some people, but there's some controversy about how efficacious they are, how well they work, because prospective randomized studies where you have the person that's giving the injection doesn't know what they're getting, and the person that's giving the injection doesn't know what they're giving. And they did 3 trials where they gave normal saline, which would be a placebo, the hyaluronic acid, and then cortisone. And out of the injection, the results show that about 25 to 30% of people got some relief with just a normal saline injection. About 25 to 30% of people got some relief with a hyaluronic acid injection, and about 60 to 65% of people got relief from cortisone injections. So the hyaluronic acid it is a little bit expensive. Some of the insurance companies cover it, some don't, and that's because of that literature that shows that there's questions as to how efficacious it is. So we don't use that too much, but there are places that do use it. Other injections, I mentioned cortisone. That's a steroid. That's a way to put a medication right in the spot where the problem is. It's depositional. It doesn't get into your bloodstream as opposed to taking a steroid pill. The steroid is an anti-inflammatory medicine, so it's a way to put the medicine in the spot where the problem is without having to take a pill, without having side effects from taking the pill. The medicine doesn't have to get in your bloodstream and then travel to the spot where the problem is. You're putting it right where the problem is. So cortisone injections can be quite helpful, as opposed to taking, and I mentioned the non-steroidal anti-inflammatories like ibuprofen or naproxen. Steroids are sometimes given for patients who have inflammatory form of arthritis like rheumatoid arthritis or psoriasis to try to get an acute flare to settle down. But there are major complications associated with taking steroids on a long-term basis. It affects your skin, it causes osteoporosis of your bones, it can actually even cause a condition called avascular necrosis where it actually causes the bone like in the hip or the shoulder to die. And so then you end up with arthritis and have to have a joint replacement for that. So those are some of the medications and injections. Ultimately, when you get to the final step, if none of that stuff's working, to maintain function, to maintain activity, it's important to be active. Humans need to be active. That's part of how we are. And an inactive person, if you are in bed for a day, you lose 3% of your muscle mass. So it is important to stay active. And so the final thing, if you're not able to do things, is to end up doing joint replacement kind of work. The bottom line, to keep a person mobile, to keep them up and going, keep you in the game, so to speak, that helps your overall health. That's an important part of being a person, being a human being. So we kind of went through all of the different, this is a little bit of an older slide. It says 23% of adults, but this kind of goes over, kind of lists the different things that we talked about. Support braces, there's other things that people use, support braces like a knee brace, that sort of thing. The literature shows that buying a really expensive brace, like they do some of these braces where they like make a mold of your leg and then they make the brace that's supposed to be a custom brace. Well, it turns out those really don't work any better than the brace that you can get at Dick's Sporting Goods. They all work about the same as long as it fits decently. So there's been different types of braces out there in the past, but none of them have been shown to be any more effective than just an off-the-shelf, relatively inexpensive brace. So there's not a good reason to spend a lot of money on a brace. Other things that we look at, nutritional supplements. I mean, eating a good diet is important, obviously. Making sure that you're getting proper protein, minerals, vitamins. Supplements are, unless there's a specific problem that you have where you're not getting a certain type of nutrition, that's where supplements can come in. But otherwise, from a dietary standpoint, eating a good healthy diet, the body only uses what it needs and the rest of it is just passes right on through. So that's the deal with the supplements. We talked about cartilage replacement. Those are the grafting procedures that we do. Part of what we do when we do, especially knee surgeries, we do use robotic navigation. That makes the surgery less invasive. There's things that we do to try to promote activities. If you do have to have surgery, our goal is to get you up and going as quick as possible. In other words, we get you up even the day of surgery and get you going. What are we supposed to do from an activity standpoint? We talked about restrictions as far as the physical therapy goes. Low impact activities like walking, hiking, treadmill, exercycle, those things are good for joints. But running, jumping, jogging, those are high impact types of things. Heavy manual labor, those are high impact activities that can negatively impact joint function. So just in conclusion, first step is to make a proper diagnosis to know exactly what's going on. What is the cause of the joint pain? That helps us make a proper treatment plan. Orthopedic surgeons such as myself are the musculoskeletal doctors, so to speak. Rheumatologists are another musculoskeletal physician. as I mentioned, and then basically we talked about knee and hip preservation program can have benefits for you. So thank you for coming, and I hope that gives some information to you that's useful.